Welcome back to the channel. If you are preparing for an interview, no matter you're general medical surgical nurses or ICU nurses who is transiting to a new hospital, you are in the right place. Today, I'm breaking down the top 10 most common interview questions for your transition to ICU and giving you insights on how to answer them confidently. Let's dive in. Question number 1. Can you tell us about yourself? This question is your chance to give a brief overview of your background, experience, and what makes you a great fit in the ICU role. Focus on your education, relevant work experience, and passion for critical care nursing. If you're general nurses, you can answer. Of course, I'm passionately registered nurse with 5 years of experience working in a medical surgical environment. Throughout my career, I've honed my skills in patient care, time management, and effective communication with patients, families, and healthcare team. I'm particularly drawn to the ICU because I thrive in fast-paced, challenging environment that require critical thinking and precision. I'm eager to bring my commitment to delivering high-quality care to the role in the ICU and to continue growing professionally in such a specialized field. For those who are previous ICU nurses, you can consider answer like that. Thank you for asking. I've been a registered ICU nurse for 5 years, during which I've developed expertise in managing critical ill patients and providing evidence-based care under high-pressure conditions. My experience includes handling ventilator patients, managing multiple vasoactive medications, and responding to rapid changes in patient conditions. I'm highly skilled in collaborating with multidisciplinary teams and maintaining clear, concise communication during emergencies. I'm passionate about ICU environment because it allows me to make a tangible impact on patient outcomes and continuous challenging myself. I am excited to bring my experience to your hospital and continue delivering exceptional care. And for your answer, you can also answer a bit more like your experience and what you are very specialized in. For example, ventilator patient, neurosurgical conditions, or any specific specialty you're good at. Question number 2. What inspired you to become an ICU nurse? This question helps interviewers understand your motivation and passion for critical care nursing. Answer number 1 for general nurse transiting to ICU. So throughout my nursing journey, I've always been drawn to situations that challenge my critical thinking and require rapid decision making. While working in medical units, I often encounter critically ill patients and felt a strong desire to gain the advanced skills necessary to provide them with the highest level of care. I was inspired by the ICU nurses I work alongside. Seeing their expertise and calm mentality during high-pressure situations motivated me to specialize in critical care. I want to make a difference in the lives of patients and their families during some of their vulnerable moments. Answer number 2 for experienced ICU nurse. So what inspired me was the opportunity to make a profound impact during the most critical moments of a patient's life. Early in my career, I cared for a patient who required ICU-level intervention, and I was amazed by how the ICU team worked together, combining advanced technology with a human touch. That experience ignited my passion for critical care nursing. I thrive in an environment where precision, quick thinking, and teamwork are essential. The complexity of ICU nursing inspires me to continually learn and grow while providing the best possible care for the patients. So question number 3, how do you handle high-stress situations? ICU nursing is intense, and this question assesses your stress management skills. And this is very, very common. So you can answer like that. I handle high-stress situations by staying calm, focusing on the task at hand and prioritizing patient safety. I rely on my training and experience and found that effective communication with my team is the key to manage stress. I also practice self-care outside of work to maintain a healthy work-life balance. For example, I practice yoga regularly, and listening to jazz are my favorite ways to relieve pressure. So question number 4. Can you describe a challenging case you have worked on? So this question evaluates your problem-solving skills and ability to handle complex cases. So you can answer like that. One challenging case I've worked on was a patient with a history of COPD who came in with acute respiratory distress. Despite initiating oxygen therapy and closely monitoring the vitals, the patient continued to deteriorate. I coordinated with the physician to escalate care, eventually preparing the patient for transfer to the ICU. It was an intense situation, but it taught me the importance of teamwork, communication, and recognizing early signs of deterioration. So answer number 2 for ICU nurse. A particularly challenging case I handled was a septic shock patient who required multiple vasopressors and continuous monitoring. Their condition was so unstable with rapidly fluctuating blood pressure and deteriorating organ function. I had to carefully titrate medications, monitor arterial blood gases, and communicate constantly with multidisciplinary team. Despite the complexity, we stabilized the patient and it was rewarding to see them improve over time. It reinforced my ability to stay calm under pressure and use critical thinking in high-stakes situations. And for this question, you definitely can add on your cases, your experience, or your scenario. So question number 5, how do you prioritize patient care in the ICU? So this question assesses your organizational skills and ability to manage multiple tasks. So my suggested responses. In the ICU, prioritizing patient care starts with a thorough shift handover and a quick assessment of each patient's condition to determine the acuity and urgency of their needs. So I use the approach of ABCDE, airway, breathing, circulation, disability, exposure to identify any life-threatening issue that need immediate intervention. For example, I have a patient with unstable vitals or one experiencing respiratory distress. I will prioritize them first. Simultaneously, I ensure routine tasks like medication, administration, monitoring, and charting are organized using various clinical tools. Delegation is also the key, so I collaborate with multidisciplinary team and other nurses to distribute tasks effectively, especially during high-demand situations. Lastly, I reassess patients frequently as conditions can change rapidly in the ICU. And I adjust my priorities according to address any new developing issues. Staying calm, flexible, and communicative is essential to ensure all patients receive timely, high-quality care. So question number 6. What do you think is the most important quality for an ICU nurse? So this question highlights what you value most in the role and how you approach patient care in a critical care setting. My suggested answer is, I believe the most important qualities for an ICU nurse are teamwork and a strong sense of awareness. In the ICU, patient conditions can change rapidly, and it's crucial to remain constantly alert to any subtle changes to vital signs, lab results, or clinical presentation. This sense of awareness allows us to detect potential complications early and act swiftly to prevent any deterioration. Equally important is teamwork. The ICU environment is highly collaborative and no one can manage it all by herself. Nurses, doctors, respiratory therapists, and other team members must communicate effectively and support each other to deliver the best possible care. For example, if a patient suddenly becomes unstable, being able to work seamlessly with the team, delegating tasks, sharing information, and anticipating each other's needs can make all the difference in achieving a positive outcome. So together, awareness and teamwork ensure that patients receive timely, coordinated, high-quality care in the ICU. So question number 7. How do you stay updated with the latest ICU practices? So this question evaluates your commitment to professional development and staying current in the ICU field. So my suggested response is more like Australia specific. I stay updated by combining hands-on learning opportunities with ongoing professional development. I regularly review evidence-based guidelines from organizations like the Australian College of Critical Care Nurses, ACCCN, and the Society of Critical Care Medicine, SCCM. I attend conferences, participate in workshops, and complete advanced courses like Advanced Life Support ARS to sharpen my critical care skills and stay informed about emerging practices. I also make time to read ICU-focused journals such as Critical Care Medicine and Australian Critical Care to stay informed about the latest research and developments. Engaging with online nursing communities and forums allows me to exchange insights with fellow ICU professionals from around the globe. At my workplace, I actively participate in training programs and multidisciplinary case reviews, which provide practical insight into applying the new technologies or treatments. So this combination of structured learning, professional networking, and on-the-ground training ensures I remain up to date with the evolving ICU practices, enabling me to deliver the highest standard of care. So key point is, make sure you include these. I stay updated by attending conferences, participating in workshops, and reading the latest medical journals. I also engage with online nursing communities and take part in training programs offered by my hospital. Continuous learning is essential in critical care nursing, where new practices and technologies are always emerging. Question number 8. How do you handle disagreements with colleagues? This question assesses your conflict resolution skills and ability to work in a team environment. So my suggested response is, when disagreements arise, I approach them with open communication and focus on finding a solution that benefits the patient. I listen to my colleagues' perspective and aim to understand their concerns. If needed, I involve a supervisor or mediator to help resolve the issue. Question number 9. What would you do if a patient's condition suddenly deteriorates? So this question evaluates your ability to respond quickly and effectively in emergencies. My suggested responses. If a patient's condition suddenly deteriorates, I would immediately assess the situation, call for assistance, very important, and begin emergency procedures as needed. I would communicate with the healthcare team and ensure appropriate equipment and resources are in place to address the emergency. My priority is always patient safety and effective intervention. And I will mention more about scenario-based interview questions and how to answer it in the next video. So question number 10. Why should we hire you for this ICU position? It's not too common since it's quite straightforward, but potentially they will still ask this question. But this is your moment to shine. The suggested response is, you should consider me because I bring a strong foundation in nursing, a passion for critical care, and a commitment to excellence. My experience in managing complex patients, strong teamwork skills, and eagerness to continuously learn make me a great fit for your ICU team. I'm confident I can contribute positively to patient outcomes and the team dynamic. Big tip: be confident but humble. And tailor your answer to the specific qualities they're looking for. So those are the top 10 interview questions for ICU nurses, along with the tips to ace them. Remember, preparation is key. Practice your answers, stay confident, and show your passion for critical care. In the next video, I'll talk about various scenario-based interview questions and how to answer them. And if you found this video helpful, don't forget to hit the like button and subscribe to the channel for more nursing tips. And let me know in the comments what's the most challenging question that you have come across. And please share it to me. Let's learn together, and thanks for watching. And I'll see you in the next video. See ya, bye-bye.